Welcome to the Doctor Janine Show. I'm Doctor Janine Bowring, naturopathic doctor, and today we're talking about hormonal imbalance for women and how to balance your hormones. It is National Infertility Awareness Week, so in honor of this, I will be sharing a lot of information. So this is a jam-packed full show of a lot of information. I'll be talking about PCOS, as well as PMS and PMDD, and endometriosis. So make sure you stay tuned for the entire episode. It's going to be really fun. We do have our trivia that comes up close to the end of the show, and this week we actually have 2 giveaways, which is awesome. So we'll be giving away one of the famous Dr. Janine mugs, as well as from our sponsors at VitaTree, the Vita Women's Formula. So now it's called the Women's Formula. There's been a name change on this one, but this is fantastic. We'll be talking about some of the herbal medicines in this formulation in today's show. If you're new to my channel, welcome in. It's so great to have you all here, and all my new TikTok followers, hello to all of you. It's going to be a fun show, so make sure you stay tuned at the end, everybody on TikTok, because I will stay online with TikTok to answer your questions, which is going to be fantastic. If you have any questions or comments throughout the show, please make sure that you are putting them in the comment section. So we are live here on YouTube, on Instagram, on Facebook, and of course on TikTok as well. And I appreciate all the thumbs up and all of those prizes that you can send me. It really makes the show so much more fun. Okay, so here we go. Let's talk first a little bit about PCOS, some of the causes and symptoms of polycystic ovaries. So this is, of course, a disorder that happens in women, and it's due to this hormonal imbalance. And one of the risk factors for this is that it can actually lead to ovarian cancer. So being proactive and preemptive on all of these, endocrine disorders, especially as related to women, is really important in terms of prevention, but also treating these things, of course, naturally, which is what I'm all about, and doing it in ways that you are actually supporting your body and finding that hormonal balance. This can lead to low sex drive and some other symptoms as well. So, the causes that are known of PCOS, unfortunately, in mainstream allopathic medicine, there's not an agreement as to what the actual cause is of PCOS yet. I do have some clues as to, why things get out of balance for women who do suffer with PCOS, and of course that's what I'll be talking about today. And, one of those things is the imbalance of the estrogen and progesterone. So this ties back to something called leptin resistance. So if you've seen some of my material before, you know that I do talk a lot about leptin resistance, which is a relatively unspoken reason for not only overall inflammation in the body, but also problems with hormonal imbalance. And when we take a look at this slide and what's happening with leptin resistance, we can see that not only is it because of weight gain, so weight gain is one of those problems that definitely causes an increase in the leptin, and the leptin levels increasing then causes something called CRP. So this is one of the things can actually be tested in your blood work, that highly sensitive CRP, and when that CRP is elevated and binding that leptin, then we have a problem. Now the leptin receptors are no longer seeing that signal in the brain, in the hypothalamus. If we go back to that, we can see the brain isn't getting that signal of the high leptin, and this is where the resistance happens. So now what happens, because the brain's not getting that proper signaling, is that we tend to eat more food, and especially all the wrong foods. So it's the carbohydrates, then we have an increase in blood glucose. This is then affecting our insulin resistance as well. We put on more weight. The more body fat that we have, the more leptin we have. So this is a never-ending vicious cycle of the leptin resistance until we get a handle on this. So if you've missed my show on leptin resistance, I really want you to check it out. It's really important for hormonal balance and for all women that are having any type of symptom or, one of the diseases that we're talking about today. Really important to get that leptin signaling under control. So that is in another show that you can check at another time. And one of the other, pinpoint markers of PCOS is higher androgen. So the testosterone level in women will increase, and this can cause various symptoms like the, added hair growth and hair growth in the wrong places. And also metabolic syndrome is actually 2 times more common in women with PCOS as opposed to women who don't have PCOS. PCOS. So we know that metabolic syndrome, just like I was explaining in the leptin resistance, is related to that insulin resistance as well. Okay, so let's go through some of the symptoms of PCOS. So one of the main symptoms we can see on this graph is excessive body hair growth. So this could be on the chest, certainly on the face, which a lot of women need to go and do laser therapy and things to try to remove this, but it can be on the thumbs and even on the toes. So, you may think, oh, that's kind of weird that, I'm having a lot of hair growing there, but yeah, it could be because of PCOS. So all the more reason to pay attention to today's episode and what to do about it naturally, as well as weight changes. So the gaining of weight is most commonly what women will experience, and trouble losing weight. So you might be, changing your diet and doing things to help to get that weight off, and you might be successful for a short amount of time. And yet you get into this yo-yo cycling, and this is, again, because of relating it back to the leptin resistance, craving the carbohydrates. Your willpower will only get you so far, and that weight keeps coming back. So this is partially hormonally related to your estrogen and your progesterone levels as well as ovarian cysts, of course, can be, part of this syndrome. Irregular or missed periods, so again, changes in your menstrual cycles. Also male pattern baldness and thinning hair. So this is something that, women don't like this, but that hair loss definitely can be related to this hormonal imbalance and the PCOS. Also high testosterone levels. So this is often why we get the hair growth, and, some of the other, deepening of the voice can be related, and the infertility as well can be related to the high testosterone. Also insulin resistance. So as it's related, as I said, to the leptin resistance, also fatigue, lack of energy. Acne is a common symptom that a lot of women with PCOS will suffer through as well. Mood changes and irritability especially, and this can be related to the liver and liver health. We know that the liver helps to process our hormones, so that's another thing to be aware of. And with infertility, so difficulty with conception and conceiving, and maybe not being able to maintain a healthy pregnancy. Now, some of the less common symptoms that you may not have heard of as it's related to PCOS can be that deeper voice, which I mentioned, but also a decrease in breast size, and this can be related to those higher testosterone levels. Brain fog and foggy thinking can be related to this as well. A darkening of the skin can happen, and also skin tags, and this is again related to that insulin resistance, and that relates back to that leptin resistance. So it's usually the leptin resistance that happens first, and then the insulin resistance happens as a sequelae to the leptin resistance. So if you're just tuning in, welcome into the program. Today I'm talking about balancing the hormones for women. We're talking about, and we will be getting to PMS and PMDD in just a moment. Hello to all my TikTok followers and viewers. So nice to see you here. I see that a few of my regulars are watching. So Melbert is here. Francis is here. Hello, hello. So great to have you all here. Hello to Natalie on Facebook. Thank you for tuning in. And stay tuned, because don't forget, our quiz section is coming up, and we have 2 prizes this week, so it's going to be fun for all of those of you who studied from last week's episode. That's kind of the little tip. If you watch last week's episode, you'll get a lot of the insights as to what the quiz questions and the answers will be for this week. Okay, let's continue. So now let's talk about PMS and PMDD and what PMDD is. So often this can be related to a magnesium deficiency. So this is, something that's really important. Most people have a deficiency of magnesium. Getting enough magnesium in our food can be very difficult for most people because of our over-fertilization and farming. So we're simply not getting the magnesium in the foods that we use to get that, enough and substantial amounts of magnesium. Now, another common issue here is estrogen dominance. So when we have a relative increase of estrogen as opposed to that progesterone in our body, this is called estrogen dominance. We also have xenoestrogen exposure in our lives. Unfortunately, this is something that I covered in a previous episode when we talked about fibroids. So really important that we do whatever we can to limit our exposure to those xenoestrogens. Now, some of the symptoms of PMS and PMDD are are mood swings, as well as chronic headaches can be, a big problem as well. An increase in anxiety and crying very easily can be other, symptoms that are problematic. Also, acne and oily skin, as well as lack of energy and just overall fatigue, and even chronic fatigue can be related to these syndromes, as well as abdominal bloating and just feeling uncomfortable all the time. A lot of food cravings, always for the wrong stuff. We never crave the broccoli and the cauliflower. Of course we crave all of the sugars and those things that are working against us in terms of having, these syndromes and disorders, as well as tender and swollen breasts can be very common in PMS, especially, right before your cycle. Very commonly related to that hormonal imbalance, difficulty in concentration, decrease in your libido, your sexual energy and desire, as well as menstrual cramps and a lot of cramping. And the cramping that isn't necessarily right, sorry guys, I'm being graphic talking about women's stuff. The cramping isn't exactly always when you're actually bleeding during your menses. It can be before the cycle as well. So yeah. One of those things that, again, women, we suffer through, and we need not. And that's why I do these shows, to really help to enlighten you and to help you to feel better. Also, GI symptoms, so whether that's diarrhea, constipation, it can go back and forth depending on where you are in your cycle. And this is, really common for women, that, the things that we suffer through. Now, PMDD, so this is premenstrual dysphoric disorder. So this is the way I describe this. It's like PMS on steroids. So it is, again, all of those symptoms, and they are exasperated to the point where you can have mental, emotional ramifications in terms of your level of suffering. And a lot of practitioners, sometimes aren't aware of the fact that this disorder with the PMDD is, an actual thing. And I've spoken to many women who said, how do I get this diagnosed? Because my practitioner simply, I've done my own research, and my practitioner has never mentioned this before, that it is, an actual disorder that is documented. And, so this is something that I just want you to advocate for your own body, and, make sure you stay tuned for the tips on how to deal with all of these hormonal imbalances, so that you can really, start to do things positively for your own health, so that you can start to feel better. So a few shout outs really quickly to Yellow Rose from UK. Nice to see you on YouTube. And there's a question, I think it's from Yellow Rose, is it normal to have pain around your hips? Yes, so pelvic pain and pain around the pelvic organs and in the hips can be related to these disorders as well. So that's a great question. Thank you for bringing that up. So any type of pain, anything that's not normal, we should never have pain. Anything that, comes up in your body that is not normal definitely needs to be checked out, and you need to investigate and, again, advocate for your own body and get to the bottom of it. Okay, let's talk now about endometriosis. So endometriosis is, what happens is that there's endometrial tissue which lines our uterus, and this spreads to places outside where it should be. So it can implant in places like the fallopian tubes, the ovaries, and in the pelvic region area, even in the nose. So this is something that can, as soon as that endometrium is, not fertilized by an egg, and that's the whole point of having the endometrium, is that for pregnancy, that it helps to support the growth of that fertilized egg. But if that doesn't happen, then we have our menstruation, and that supposed to happen monthly for women, which is the shedding of the lining of that endometrial tissue. So what happens now with women that are suffering with the endometriosis is that you can have an actual bleed in areas, so like a nosebleed around the time of the period, if there is that endometrial tissue that is there, which is, I know it sounds weird, but it can and does happen. But also, if a bleed can't happen in that endometrial tissue, well, then that can cause pain and inflammation, and this can happen monthly. Also, sequelae to this is that you can have adhesions, and scar tissue may build up, and the organs can actually have stickiness and adhesions to one another because of this endometrial tissue. And the fallopian tubes can actually even close up because of some of that scar tissue. So then this can lead to infertility. So it's definitely something that needs to be addressed, and that's why that when I talk about the tips in just a few moments, you will be grateful for the fact that you can do a lot of things naturally to be able to help yourself, especially if you've been trying to deal with these things, any of the things that I'm talking about today for female health, and you're not getting that resolution. Then this is why it's so important to stay tuned and to be a part of learning about how to do things naturally. So if you're just tuning in, I'm Dr. Janine Bowring. Today we're talking about hormonal imbalance and how to balance your hormones naturally. Hello to everyone on TikTok, all my new followers. It has been a crazy week. So for those of you who don't know, we hit some milestones last week. I did a whole video on getting 100K followers, and now I think it's at 260 or 70K followers about that. So it is great to be sharing all of this great natural health information. And hello to everyone on YouTube, on Facebook, and on Instagram Live as well. It's nice to have you all here. Remember to continue to, put your questions and your comments throughout the show. And also this will live live, not live anymore. It's live now, but it will live on YouTube after the fact, after we're finished streaming today. So you can always refer back to this episode in case you missed something, you're not taking your notes today like a lot of our viewers do, that you can come back to it and, use it as a reference. Okay, so what are the symptoms of endometriosis? So definitely painful periods, and it's called dysmenorrhea, and irregular cycles as well. So irregular periods, there may be excessive bleeding, and bleeding that doesn't happen regularly. So instead of once a month, it can happen throughout the month at different times, and this is called metrorrhagia, as well as low back pain and abdominal pains. There could be constipation and diarrhea as well. There could be pain with intercourse and increased pain even during bowel movements and even urination because of where that endometrial tissue or maybe the scar tissue is sitting in terms of the pelvic region. Also infertility, which I had mentioned because of that fibrous tissue and the scar tissue that can build up in the fallopian tubes. Joint pains can be related to this as well, nerve pains as well, and chronic fatigue and just extreme fatigue and not having your energy. A lot of gas and bloating as well can be related to this. So again, if you've got any of these symptoms, you definitely have to advocate for your own body, get to the bottom of it, and do your due diligence to take now. We're going to talk about the 9 tips to balance your hormones to really find relief in terms of, any of this that you may be suffering through. Okay, are we ready? So be ready to take your notes. The 9 tips to balance your hormones. So tip number 1 is to fix your environment. It is so important that, especially, and I've talked about this in previous episodes, you want to decrease your blue light exposure. So whether this is just being indoors, being behind windows, if it's from your cell phone use, especially close to bedtime, is the worst thing you can do for your hormones. You also want to make sure that, you are limiting your EMF exposure at the same time. So whether that's from 5G, from Wi-Fi, from any type of electrical device or anything that has a signal, basically is inundating your body with EMF. So I have an entire episode all about EMF exposure and what to do about that naturally to mitigate your risk. So definitely make sure that you check that out. Okay, tip number 2 for balancing your hormones is to fix your leptin resistance. So for those of you who've watched me for a while, you know that this is not a surprise that I talk about fixing your leptin resistance. And I have an entire show on this, but it's really important. In normal leptin signaling, the brain is getting the right signaling and the right messages, and all your hormones work appropriately like they're supposed to. But when we have leptin resistance, the brain simply isn't getting that leptin signal, and now we have higher leptin levels, and it's not being recognized by the brain. So studies have actually shown the link between high leptin levels and PCOS. So I think we can show you this study really quickly in terms of relationship with PCOS, but also studies have shown the link with endometriosis. So here we can see that leptin levels in women with polycystic ovaries, in in this review showed that high leptin may contribute to the etiology or the cause of the development of PCOS. So that's huge. I mean, not many people that I'm aware of talk about these links as it's related to leptin. So another one is the relationship with endometriosis and leptin. And here we can see that the leptin receptor is induced in endometriosis, and leptin stimulates the growth of these endometriotic epithelial cells. And it goes into describing the different pathways in this study. So again, who knew that the leptin resistance? So you can understand and appreciate why I always come back to and refer you to that leptin resistance show. So this is really important that you educate yourself, and there are specific herbal medicines that actually help with leptin and that leptin signaling. So make sure you check out the link. We'll put that in the description of this video on YouTube after the fact so that you can see that and you can, educate yourself about that. Okay, tip number 3 for these hormonal imbalances is to use a castor oil pack. So please look at my video about how to do the castor oil pack. You're going to do it over your entire abdomen, including the liver area, which is on your right hand side under your right rib cage. So make a big pack, especially if you've got the cramping and the pain associated with the polycystic ovaries and the endometrial tissue. You're going to wrap that pack and do it at least 3 times a week for 45 minutes. This is really fantastic, not only for the pain, but for the detox mechanism through the liver. We know that our liver is what helps us with the detoxification and deconjugation of our estrogen. So especially if that estrogen is out of balance in terms of estrogen dominance, this is one of the best go-to things that you can do, and you will find relief and very quickly. So I can't wait to hear from you. Please leave it in the comments below so that I know how well you're doing. I love to hear all your feedback, which is fantastic, especially when you take the tips. And you guys are so, guys and gals are so great at letting me know that things are working for you. So I'm so grateful whenever I see those. I got a message on TikTok I think it was it last night? Yeah, just before I was going to bed, about someone who took some advice about what I had shared in a TikTok, and that, she was feeling so much better and her symptoms completely disappeared, and she was so grateful. And I messaged her back immediately. I said, you just made my day. I mean, that's why I do what I do, and I share all of this great information with you. Okay, tip number 4 is Mother Nature's prescription. So this means getting outside, getting into Mother Nature. You want to move, you want to exercise, you want to do this outside in the fresh air as much as you possibly can. Getting natural sunlight exposure is really important. This really helps your leptin levels and your hormonal signaling and your circadian rhythms. Getting grounded on the earth, meaning bare feet in the grass, on the sand, on the ground, is really important for your health and your circadian rhythms and your leptin as well. And drinking high quality water. So definitely making sure that you are hydrated. Your cells simply don't work if you are dehydrated. And in terms of getting the fresh air, you want to get out of the city and get away from that city pollution as much as you can. If it can't happen during the week, maybe you're at home working, you live in the city, at least on the weekend, try to do your best to get out into nature and go on some trails and breathe in that fresh oxygen that Mother Nature does prescribe for us. Okay, tip number 5 is the foods to avoid, especially if you've got this imbalance with your, estrogen dominance and some of those xenoestrogens, and you've got a lot of the cramping and, things just aren't going the way that they should. You've got to watch the caffeine. So for anybody who watches, you know that I love my coffee, and I have it, usually mid-morning, so not first thing in the morning, but I do love my coffee. But unfortunately, too much caffeine actually depletes your magnesium levels, and magnesium is really important for our hormonal health. It's really important for the PMS and the PMDD, and as women, we tend to be deficient in magnesium anyway. So by, one of the telltale signs that you're deficient in magnesium is that you actually crave chocolate. So if you crave chocolate all the time, that's your body telling you that maybe there's an iron deficiency as well, but also a magnesium deficiency. So yeah, you want that, a little bit of chocolate is good. I love my chocolate as well, and I love my coffee, but you don't want to overdo it. So you want to limit your caffeine. 1 to 2 cups a day is probably the max, especially if you're highly symptomatic for any of the conditions that we're discussing today. Okay, the second food is sugar. So unfortunately, yes, you've got to watch, especially especially the refined sugar. This really messes up your leptin signaling, so it's something that I talk about and refer to in my leptin resistance show. So you want to decrease your sugar and especially the refined carbohydrates as much as possible. Okay, the next group of foods are the polyunsaturated fats. So these are the highly processed, whether it is the canola oil, the vegetable oil, the soybean oil, the seed oils. They are highly inflammatory, and anything that's inflammatory is really going to mess with especially your female hormones. So you definitely want to decrease these as much as you can and gravitate more towards the healthy fats, which are important, and I'm going to mention those in just a second. So tip number 6 are the dietary changes that you can certainly, start to implement. So we talked about definitely decreasing those starchy carbohydrates and the refined carbohydrates. So going towards a healthier, lower carb diet is definitely healthier, and increasing your protein, especially at breakfast. So this is something that I talk about in my leptin show. You want to eat a high protein breakfast, not a lot of carbohydrates, and this will help to reset your leptin signaling. Also, you want to increase a specific food group that contains indole 3 carbanols. So these are specifically important for balancing out our estrogen. They help to trap the bad estrogen. So this is the brassica family of the vegetables, including broccoli. So one of my absolute favorites, as well as Brussels sprouts, are also in this indole 3 carbonol group. Cauliflower is also fantastic, and kale. So this is something that, in terms of being able to, make sure that we have enough of these indole 3 carbonol brassica family of vegetables. So either eating them raw or lightly steamed is important, as well as increasing your good fats. So your good fats include, I love coconut oil for this reason, because it has MCT, so medium chain triglycerides, which are fantastic. And another one of my favorites, of course, are avocados, which have natural healthy fats, and also DHA. So DHA is from fish oil, so eating some smaller fatty fish throughout the week is probably okay, but I tend to rely more, honestly, on my DHA supplement. So I'll put the link in I won't put it, but my team here behind the scenes will put the link in the description to, a high quality DHA supplement to ensure that you're getting enough. And as humans, we tend to be much more deficient in the DHA as opposed to the EPA. Not all fish oils are created equally. So the one that I take is a higher skew, a 40-to-10 ratio of that DHA, which is important for brain function. It's important for our leptin signaling. It's important for our mitochondrial health. So getting enough DHA is really important. Okay, tip number 7 is to use some specific herbal medicine. So I've talked about in a previous episode about doing a full body detox. So this is something that, some of my favorite herbal medicines, and we'll start off with chlorella, which is a blue-green algae. I know a ton of people had questions about chlorophyll versus chlorella. I tend to actually prefer the chlorella, and that's because it does contain the chlorophyll, but you get the added benefits of other nutrients in the chlorella. And what chlorella does is it helps to trap heavy metal toxins, so things like mercury, aluminum, which do have a negative impact on our cellular health and on our organ health, especially in our brain as well. So that's why I like to use the chlorella in my full body detox, as well as dandelion. So dandelion, I've seen a lot of posts. I'll be doing some posts on dandelion as well. A lot of people talking about dandelion. So the leaves of the dandelion help as a kidney detox, but the root is actually utilized for a liver detox and helps to cleanse the blood as well. I've seen videos of people just chomping on dandelion roots. It doesn't work that way. It's got to be broken down, and extracted in terms of the active components of the dandelion root. So that's something that definitely in a standardized formula you will find that. So the link will be in the description as to the full body detox and the ingredients there if you want to get more information about that. Also, when we talk about milk thistle, so the milk thistle is also really important in terms of being able to detoxify the liver, helps to actually regenerate healthy liver cells, which is important as well in terms of getting our liver healthy. And remember, our liver, the conjugation of our hormones is really important through our liver. So this is something that we definitely want to address PCOS, and the milk thistle helps to do that. Parsley as well helps to detoxify the blood, but helps with detoxifying the kidneys as well. Burdock root I love as well because it helps to cleanse the blood and the lungs, but also helps with kidney detoxification, and that's really important in terms of, when we talk about our major detox organs internally, we always want to address the big ones. So the liver, the kidneys, the skin, the digestive tract. Burdock helps with cleansing the skin. So for women, that have the PCOS and they've got, a lot of the chronic acne on the skin, that's why doing the full body detox with all of these herbal medicines, you can see that it's multifactorial in the way that it can help you. Cascara sagrada is also a favorite herbal medicine that gently gets the digestive tract moving, and horsetail herb is great for the kidneys as well as bearberries. So that combination of all of those herbals is something that I highly recommend, and doing a full body detox at least 4 times a year. So that's something that you do at the change of the seasons. But if you want more information about that, the links are below. And also watch my detoxification episode where we talked about that last week in terms of being able to fully detoxify all of your internal organs, and doing that, every 3 to 4 months ideally. Okay, as well as cinnamon. So cinnamon, actually, if you want to utilize this in your baking, if you are having that coffee in the morning, as I do, you can sprinkle some cinnamon. This really helps to balance blood glucose levels, so helps with the insulin resistance and the metabolic syndrome as it's related to these female conditions as well. Some of my other favorite herbal medicines for more now specifically dealing with the female hormones is chaste tree berry. So chaste tree berry is known to help with our progesterone levels. So often progesterone can be relatively out of balance, and it can be a little bit lower as compared to our estrogen levels. So that's something in the chaste tree berry that is very balancing. Black cohosh is another one of my favorites, and don't listen to the negative news about black cohosh. It simply isn't true. If you get, a standardized extract of black cohosh, this is definitely helpful for your estrogen and balancing your estrogen levels. So there's a lot of misconceptions. A lot of people don't understand black cohosh, but it works like a phytoestrogen, so it actually protects you from the bad estrogens, those xenoestrogens that I've spoke about, before in previous episodes. As well as black maca. So maca is an adaptogenic herb, so this is really important for stress levels, cortisol levels, which is partially related to that leptin resistance. So I didn't, talk about the pregnenolone steal in today's episode, but it's definitely something that you're going to find in my other videos that you can educate yourself a little bit more about why it's important to balance out, especially your cortisol levels, and something that works as an adaptogenic like the black maca can be really helpful. So there is a link in the description again below to direct you in the right direction for all of these wonderful herbal medicines in combination. Okay, tip number 9. Now don't forget I'm getting to tip number 9, so make sure that you're staying tuned because that's my favorite tip, as it always is. So stay tuned, it's about the mind-body connection. Tip number 8, let's talk about a few supplements that are really important. So I hinted upon the fact that magnesium deficiency is very much related to the hormones being out of balance. So that's making sure that you're getting enough magnesium. I take my magnesium every morning, and it's a magnesium bisglycinate, so that's something definitely that you want to look for, and without the fillers, without the flow agents, without the magnesium stearate. But that's a whole other show that I'll one day talk about, the magnesium stearate. As well as calcium. So calcium, you want to take a whole food calcium. In terms of getting it from dietary sources, sometimes it's difficult, that it's not going to be well absorbed, and dairy is not your best friend when we're talking about calcium. So I'm just going to put that out there. Maybe controversial, but again, in my years of practice as a naturopathic doctor, I have never found that dairy is the best source to get absorbable calcium into the body. As well as vitamin D3, so that's the triad, the magnesium, the calcium, and the vitamin D3. Those 3 together are super important. So natural sunlight exposure is really important for your vitamin D levels, as well as, if you need to go to a supplement, then getting it in a D3 is much more important, and I have a lot of posts on the difference between these. As well as zinc. Now, zinc goes along with copper, and zinc and copper are equally as beneficial and as important for women to help to balance those hormones. So finding that zinc in the right ratio is really important. It naturally occurs in seafood. So if you are one to eat seafood, which I love, my favorite form of protein, then it's naturally balanced in there. But not everybody can eat seafood, or not everybody wants to eat seafood every day. So sometimes a supplement in the right proportions is what you're looking for. Okay, so some quick shout outs. Kimberly on Facebook, nice to see you. Hello, hello. And hello to Jessica from Florida. It's your first time watching. Well, welcome into the program, and it's nice to meet you. Also, hello to everyone on TikTok. I know that we've got a ton of people here watching, so nice to see you all. Stay tuned on TikTok after the show, because I will stay on and answer your questions on TikTok. And hello to everyone who's watching on YouTube and Facebook and Instagram Live as well. This is so fun that we are able to stream to all the platforms. Okay, so tip number 9, and this is my favorite, and you know, true to myself, Dr. Janine, I always like to bring in the mind-body connection when talking about any ailment, because you know, you really can't get to the root cause often, and this is what I found with my patients year after year, is that unless I really got into, you know, the mind-body relationship and what was going on emotionally and what was going on maybe in terms of, you know, women's issues, you know, on an energetic level. So this is related to the second chakra energy, and you've heard me talk about this before, that the second chakra is the area of the body is, you know, in that pelvic region. And in terms of energetic medicine, this can be related to relationships. So you have to sort of ask yourself, and I'm just planting the seed, just ask yourself, you know, maybe you have fertility issues or PCOS issues or endometriosis. Ask yourself, maybe there is a relationship, and that's not necessarily with your significant other. This could be with your son, with your daughter, with your father, your mother, with a coworker, with your boss, a former boss. It could be anything. And even if this relationship issue happened 10, 15 years ago, 3 years ago, and you don't have resolution around it, then that energy is still stuck. And this is why you have to find resolution. So I have different tips and different videos as to how to let go of that energy. Hopefully we're going to work towards doing some, you know, group meditations and things on the social platforms, which I'm super excited about. Please give me a big thumbs up or let me know if you're into that, because we'll definitely be able to connect with you if that's something that you're willing to learn more about, and doing some group healing, which that's what I'm all about. So I love that. So yeah, let me know if you're part of that team, and we'll definitely reach out to you. But also the second chakra is related to financial issues. So a lot of people, I think we can relate in the last year, there have been some struggles, and you know, people's financial world has really been taxed in different ways in the last year. So that stuck energy, there has to be resolution. And it's not that you win $1 million, that's not going to solve it for you. It's your interaction with money, and money is energetic. Finances are energetic, so being able to, you know, manifest more of that in a positive way and letting go of any negative energy associated with this is really important at fixing the hormonal issues for you. So that's something that's really important. So check out, I've got, you know, some meditations for the second chakra, listening to specific music to help with unblocking that second chakra energy. That's something that you can find on YouTube, so do check that out. And one of my last points for the tips is, as a woman, being a woman myself, you know, and being a practitioner as well, and having seen patients and many women over the year, is don't suffer in silence. You know, it's really important that we reach out to one another, we help one another. We are all in this together, and, you know, there's someone definitely who is always willing and able to help you. And don't suffer in silence, because you could have, let's say, the PMDD and all the symptoms that you're suffering through, and you think, oh, that's just what you're destined to live and endure through this lifetime. We're not here to live and endure. We're here to enjoy and to revel in our lives, and to do it in a positive and a healthy way. And that's why I share what I do. So please reach out. You know, if you need to reach out even to me, you know, you're stuck, and so many of you do as women, and I'm very grateful for the fact that you trust in me. Please do reach out. There's always a way to help. Okay, so we came to so those were, just to sum it up, those were the 9 tips on how to deal with imbalanced hormones, how to find balance in the hormones, and thank you for staying tuned for all those. So I hope that those tips really do help you. Now we've come to my favorite part of the show. This is our quiz section. So get ready, and you only have to attempt to answer these questions. And what we're drawing for today, so even if you're not successful with the correct answer, that, you can definitely, still be eligible. So we draw for the winner. So the winner of the mug, but also from our sponsors, the women's formula. So the women's formula is, I've talked about some of the herbs today in here for balancing women's hormones. So this is fantastic from our sponsors at VitaTree. Okay, so are we ready? I think I need my device, guys, so that I can tune in. This is my water break. Is everybody ready? Thank you so much. Okay, here we go. Awesome. Thank you very much. Okay, so I have to see where we're at in terms of commenting. I probably just did something funny there. Bear with me. It's so funny because people watch me on the live TikTok, and I'm like, I'm a chaos when it comes to technology sometimes. I think I get that from my mother. And I don't see where the commenting's going to be. Can you help me, please? I don't see where the comments are, but yeah, I just need some help. Okay, are we ready? I know I've got my everybody, Melbourne is ready. Melody, hello, you're ready. Kristen is ready. We've got some questions happening, so stay tuned on TikTok after the fact because I will be answering your questions. Okay, are we ready? Thanks for bearing with us. And here we go. Okay, I'm sure it's going to come to me. Question number 1. Oh, it's not fair to my Facebook. I've got to get that back. Just one second, bear with me. So I hope you learned something new today. I mean, it's a lot of information, and the good thing about, streaming live is that you get it live, but then it also lives on Facebook and on YouTube after the fact. And eventually we'll get it up on Instagram, on IGTV as well. I don't think it lives there after it's been live, but eventually it'll get up there. And please check out, make sure you're following me on the social platforms. So please follow me on Instagram and on Facebook as well. If you're on Facebook, thank you so much. Okay, awesome. I think I got it now. Yes. Okay, are we ready? Yes, 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 yes. Natalie, okay, Kimberly's here. Do I have all my regulars here? Yes, I think so. Okay, here we go. Question number 1. Name 3 symptoms of toxicity. 3 symptoms of toxicity. We talked about this last week. You got to give me 3. Ideally in the same line, please, so I don't have to keep looking for other ones. Kimberly, wow, you're quick. Yes, good job. TikTok, we already have answers. Wow. 3 symptoms of toxicity. Thank you, Melbert. You're so kind. 3 symptoms of toxicity. YouTube. Hello, hello. Facebook. Anybody else on Facebook? Wow. Kimberly, fast. There we go. Yep. Noni Moose has it. Instagram has correct answers as well. Natalie, good. You corrected your thing. Louise, I need 3. You gave me 2. Anybody else? Going once. Going twice. TikTok's super fast. Anybody else on TikTok? Okay, so 3 symptoms. Let's show them. Symptoms of toxicity. So fatigue, rashes on your skin. That could be even acne, headaches, cough, hemorrhoids, body odor. I could go on and on and on. Brain fog. Yes, headaches came up a lot for people. That's good. Shortness of breath. Good job, Jay Roos. Swelling, yes. Sorry? Bloating is a big one. So the GI symptoms are, big signs of toxicity. So if you did miss my show on detoxification of all the internal organs, check out last week's show, and that will help you out. Okay, question number 2. Name the chemical commonly found in children's sleepwear. And I should have said the chemical which makes it flame retardant. I mentioned it last week. Does anybody know? The chemical found in children's sleepwear that makes it flame retardant. It's not a good one. Anybody? This is a tricky question. I think more or less you had to take notes from last show, unless you know this. But as a mom myself, and having had 4 babies, we have 5 kids altogether, but having had 4 babies, this was something that I was aware of, you know, being a naturopathic doctor, to always look for in terms of, and you're not necessarily going to know about this by looking at the labels. So it's really important to, and that's why I like to educate moms about how to do things naturally and always decreasing the exposure to these toxins. Wow, Kimberly, whew, good job. Kimberly is on the ball. Anybody else on YouTube? Yes, anybody else? Anybody else? Okay, so the answer was Kimberly had it right, proban or antimony. So that is the heavy metal toxin that is related to, you know, can be a lot of problems and can cause more toxicity, especially in kids and skin rashes and things. Not necessarily that you would see it on the skin immediately, but can be related. So that's something that you definitely have to be aware of. Okay, question number 3, true or false? Broccoli, cauliflower, Brussels sprouts contain I3C, which is good for xenoestrogen detoxification. So I even talked about this today. So, broccoli, cauliflower, Brussels sprouts contain I3C, which is good for xenoestrogen detoxification. TikTok has it? Wow. Instagram has it as well? Yes. Kiki, Waterloo, JJC. Yes. Sam Reed. Good job. Anybody else? Oh yeah, Natalie, Louise, Kimberly, Melanie. Good job. Good job, everyone. So it's true. Yes. So the answer is true, definitely. So this helps with those toxic estrogens. Okay, question number 4. Name the system that is active during sleep for brain detoxification. Name the system that is active during sleep for brain detox. Let's see if you're paying attention. What is this? What is that system to help with brain detoxification? That's why it's so important that we have a restful night's sleep to help with that detoxification process. Sam Reed, good guess. No. No, Rebecca. On TikTok. Anybody else? Anybody else? TikTok has it. Wow. Good job. Good job. And it's a lady. So far, she's the only one that I can see. I'm not going to say it. Oh, Kimberly. Woo. Good job on Facebook. Kimberly's quick. TikTok again? More than one? Always beggar. Okay, so that everybody doesn't... So Jenna was first on TikTok. Good job. Oh my goodness, that's fantastic. And Instagram has it as well? Good job, everybody. Fantastic. I got some smarties in the audience today. Good job. Okay, and our last question of the show. True or false? The body can detoxify on its own without the need to do detoxification. According to Dr. Janine. Anybody? Anybody? True or false? The body can detoxify on its own without the need to do detoxification. Kimberly, she's my girl. Natalie, you're my girl too. Louise, yes. Good job. Instagram has it. Mel Bird, of course, you have it correctly. Good job. Anybody else want to give a go at this? And again, I should have added to that question according to Dr. Janine. So that's not really fair. That's why, yeah, we give some leeway in terms of sending out prizes. As long as you try to answer the questions, you are entered to win the prizes that we send out for free. That's why it's so much fun here. And Natalie, that's awesome. Good job. Okay, Dom Hamilton. Yes, so the answer, according to Dr. Janine, is false. And that's why we did the whole show last week all about full body detox and what you can do naturally to detoxify and help your body. The way that I like to explain it is our body never got the upgrade of, having to deal with all of the environmental toxins that we have on a daily basis. So it's really important to do a full body detox and, to choose a healthy and often a herbal way to be able to get some of those toxins out and to really ramp up your organ function to be able to deal with that external and internal toxicity that we all are exposed to. So that's it for today's show. Thank you so much to everybody who's watching today, all my new viewers and my new followers. Welcome, welcome. It's so great to have you here. Please do leave a question or a comment in that section below if you're on YouTube or no matter where you're streaming. I would love to hear from you, as well as please do share this video. You have the ability to help someone else with this important natural health information, so you never know who you are helping on any given day, so please do share. Also, I appreciate all the thumbs up, all the fire, and there's so many fun things now that you can send on, especially on TikTok, the fire, the diamonds, and all that. I appreciate all of that, and the likes, of course, I love as well. And if you're new here, welcome to my channel. Make sure that you're subscribed, you click that bell, and make sure you're following me on all platforms. And remember to always take good care of your health and to do it naturally. Thanks for watching today.